Hello, and welcome to the PAHO podcast. This is a space where we have a conversation with experts on NCDs and unpack these most pressing health challenges. I'm Silvana Luciani, the chief of the NCD Unit at the Pan American Health Organization. And today we're diving into a very important topic, one that affects us all, and that is nutrition. What we eat, when we eat, how we eat shapes our health and can be an important risk factor for NCDs. And so to talk to me about this is my colleague, Dr. Vanessa Garcia-Larssen, Chief of the NCD Risk Factor Unit here at PAHO. Welcome, Vanessa, and thank you for being here with us today.
Thank you, Silvana. It's such a pleasure to join you for this topic.
So Vanessa, let's get started with the basics about nutrition. What can you tell our listeners about why nutrition is critical for health and why is it such an important risk factor for non-communicable diseases?
Well, that's a really good question to start the conversation. So nutrition is considered a powerful risk factor in the prevention and control of non-communicable diseases, or NCDs, because what we eat directly influences the development and progression of major NCDs, including cardiovascular diseases, obesity, diabetes, cancer, and chronic respiratory diseases. We know that insufficient intakes of key nutrients, such as those found in fruits, vegetables, and whole grains, for example, as well as high intakes of critical nutrients such as sugar, sodium, saturated fat, trans fat, have all been shown to account for a substantial proportion of global NCD mortality and disability-adjusted life years. And also dietary patterns and the foods that are high in ultra-processed foods, for example, are known to displace beneficial nutrients and are often high in nutrients of concern. So all of which increases even further the risk of NCDs.
So very good. Thank you, Vanessa. Essential nutrients that are found in fruit, vegetables, and whole grains need to be prioritized. Foods that are ultra processed and high in fat, sugar, and salt need to be avoided for health. So let's talk about what influences our nutrition, because we know it's not just about individual choice of what one chooses to eat. We know that food systems and marketing practices and one's own socioeconomic situation all shape what is available and accessible for people to consume. And we also know that front of package labeling is a really influential tool to support healthy eating and a tool that PAHO is supporting with implementation. So Vanessa, what can you tell us about front of package labeling, how it works, and why it's so helpful and impactful in our region of the Americas?
Yeah, that's correct. What people eat is largely the result of environmental and societal conditions that greatly constrain personal choice. And we know that all the scientific evidence supports that. This is why one of the major policy tools that PAHO supports is the front of package labeling. It's simple, practical, and an effective tool to inform the public about products that can be harmful for the health or can help us guide purchasing decisions. The way in which front of package labeling works is by displaying prominent simple symbols, typically black octagons on the front of packaged foods and beverages that exceeds defined thresholds for what we call nutrients of concern, such as added sugar, sodium, saturated fat, and trans fat. And so within our region, the PAHO's nutrient profile model is used to identify the products that should contain warnings on the front of the packages to signal to consumers the excessive amount of critical nutrients that can affect health. And the impact of front of package labeling in the Americas, which are mostly the black octagonal warning labels, has been substantial for several reasons. First, these warning labels are highly visible and easy to interpret, even among populations with lower health literacy, outperforming more complex systems like guideline daily amounts or traffic light warnings. The evidence from intervention studies or randomized controlled trials and also population studies in the region tell us that warning labels significantly improve consumers' ability to identify unhealthy products and also reduce the intention to purchase them. The other reason is that the implementation of warning labels has driven widespread product reformulation. And this is a good thing because manufacturers are reducing the content of nutrients of concern, like I was saying, sugar, sodium, saturated fat, to avoid warning labels. So what this leads to is to an improvement in the nutrient quality of the food supply. And then the other reason is that the adoption and implementation of the front of package labeling system has increased during the region over the past decade, which means that the effect has been multiplied. All 35 PAHO member states, for example, have discussed the front of package warning labeling system. 30 countries have formally introduced it, and 9 countries have adopted and started the implementation of front of package labeling. So we have Argentina, Brazil, Canada, Chile, Colombia, Mexico. I'm going in alphabetical order: Peru, Uruguay, and Venezuela. And of course, PAHO's support for front of package warning labeling is based on evidence that these policies are effective, scalable, and equitable tools for NCD prevention and control, especially in countries and regions where there is a high prevalence of diet-related diseases and also health disparities. And the combination of increased implementation of front of package warning labels, improved consumer understanding, reduced purchases of unhealthy products, and industry reformulation altogether explain why these labels have been so impactful in the region of the Americas. And it's actually a reference now for the regions in the world.
Well, that's excellent. The Americas region ahead of the other world regions in implementing front of package labeling. And front of package labeling sounds like a very effective tool with simple, visual, practical messages to help inform consumers on what choice is a healthy choice and what choice is not a healthy choice. And having them at the point of decision making is also very useful, it sounds. So thank you. Thank you for sharing that on front of package labeling, Vanessa. So let's move now to an area that we all care really deeply about, and that's children's nutrition. We know that childhood is a stage of life where lifelong health behaviors are formed, and we're also concerned about the increasing rates of obesity that we see in children with the changing dietary patterns and physical inactivity. So, Vanessa, what are PAHO's priorities to promote healthy eating in children and adolescents and to prevent obesity in this critical age group?
This is a really good question, and an area that is a key priority for the Pan American Health Organization. And actually, the children of the region of the Americas are the greatest asset we all have. And the recognition and protection of their distinct needs and human rights is really essential for effective development. The region has made really great strides in reducing child mortality and morbidity, using evidence-based interventions, and also new knowledge and technology. So for children's nutrition, the Pan American Health Organization prioritizes ending every form of malnutrition and making sure that all children can access nutritious foods. This is a key priority. And in order to address these priority areas, the Pan American Health Organization calls all member states for the promotion of breastfeeding and healthy eating and the improvement of food environments, especially school food environment. This is critical because, of course, this is where children spend most of their time, the first 10 years, 12 years of their lives. And this is done through the regulation of food marketing and labeling, and also through the procurement of nutritious food. And along these lines, PAHO developed a program called the Plan of Action for the Prevention of Obesity in Children and Adolescents, which identifies several strategic lines of action, in addition to the implementation of fiscal policies, for example, taxes on sugar-sweetened beverages that perhaps our listeners are familiar now with that, energy-dense and nutrient-poor products, and all of these with the goal to halt the rise of obesity epidemic, so there is no increase in the current country prevalence trends that we are observing for obesity, both overweight and obesity. And a specific example of PAHO's work in this area is providing technical support to countries in implementing a really beautiful program called the Baby Friendly Hospital Initiative, or BFHI, on a national level. And we do this through the reporting or monitoring the international code, and also developing policies to support optimal child feeding practices, all of which align with the PAHO's plan of action that I was referring a moment ago on the prevention of obesity in children and adolescents. And another example of work directly related to strengthening and improving the nutrition of children in the region refers to leadership and technical cooperation that PAHO provides to member states on healthy nutrition. And here we have a huge amount of material, including documentation on the regulation and restriction on marketing of ultra-processed foods and beverages in and around schools, but also in other settings, in community settings as well. And PAHO works closely with United Nations agencies, academic institutions, and also a number of civil society organizations supporting, promoting policies, generating and disseminating information, organizing workshops, and monitoring trends on each of these topics. And we have a wide range of material available on our website, and I invite all our listeners to look at this material. It's really helpful, and it can be used at very different levels. We have material that can be used at schools, at the communities, information that can help parents, etc.
Wonderful.
The PAHO really continuously provides technical guidance and facilitates collaboration and cooperation. That's at the center of what we do with all countries. And the overall objective is, of course, to facilitate that we have healthier environments and that we can create environments where diet can actually improve the well-being of children and the general community across the region.
Excellent. Thank you, Vanessa, for pointing out PAHO's work, especially in breastfeeding promotion, restrictions of marketing of ultra-processed food and beverages, taxation of sugar-sweetened beverages, promotion of healthy schools and school environments, all important and effective interventions to prevent childhood obesity and promote healthy eating in children. Thank you, Vanessa. And thank you for sharing all of your insights and for the work in nutrition that you and your team are leading across the Americas region, because nutrition is really at the heart of preventing non-communicable diseases. So it's really encouraging to learn all about these many, many PAHO initiatives.
Thank you, Silvana. It's been an absolute pleasure. As I said, we have loads of resources available on our website, and including courses and self-help guidelines with material nutrition. And I encourage everyone listening, policymakers, educators, families, to join us in creating healthy food environments. It is a task that requires an absolutely multi-sectoral cooperation effort. So thank you.
Thank you, Vanessa. And to our listeners, thank you for joining us today. I really do hope that we've brought you new information and inspired you to promote NCD prevention and nutrition. And if today's episode resonated with you, please share it with your networks. And also please visit the PAHO website for resources, data, guides, information, and also follow our social media channels. So until next time, stay informed, stay engaged, and stay healthy.